My name is Paul McClintock. I'm a GP at Burnbrae Medical Group in Hexham. We have been care planning with patients with diabetes in our practice for 5 years, and it is now considered normal care. Our patients mostly can't remember the previous system and how that worked. They expect to get their letters with their results prior to their appointment with our diabetes team, so that they have time to think about what they want to get out of their appointment. They are used to the techniques involved in the consultation and are prepared to construct their care plan. As we have been doing it over several years, we have noticed the advantages accrue. Some of the advantages are education appropriate to their level of understanding, empowerment, good relationships, and perhaps most importantly, time. Time to think after they get the result, time to discuss in the care planning consultation, particularly as there are no distractions by being measured. Time afterwards with the plan to reflect what was discussed and how they might achieve some of their goals. I shall try to illustrate these points with a real patient case. Mrs. R. She was a difficult patient to help. She had hard to control blood pressure, a high glycosylated hemoglobin and a body mass index which needed some improvement. She was on her 3rd year of care planning when she finally felt able to make the changes to her life that ultimately radically altered her profile. She was aware that her glycosylated hemoglobin was up again, her blood pressure was high again, and she had put on more weight. She knew prior to the consultation that she would need to change. In the consultation, she discussed her options and resolved to have another go at the weight reduction. She came up with the idea of attending the gym and a weight reduction class. The nurse was able to refer to the Healthy Life scheme at the gym and signpost her to the local weight reduction classes. This was all reflected in the care plan, and at the end of the year she had achieved her goals. By doing this, she also managed to get a normal blood pressure and a glycosylated hemoglobin that was at target for the very first time. The good news is that 2 years on she continues to do well. It may have taken 3 years of care planning cycles, but with the information she received, the education, the empowerment, the good relationships with the staff and time, she achieved her goals. As a practice, we have also noted other advantages, one being nurses involved enjoy the clinics and manage to run to time. Another aspect to consider is the standards of care and expenditure on drugs. In 2009, our local prescribing advisor brought together our QOF performance and our drug spend for patients with diabetes. These were compared to those of our colleagues across the locality. At this point, we've been care planning for 4 years ahead of our neighbours. Outcome measures are always going to be difficult to work out, but if we use glycosylated hemoglobin as a proxy for a health outcome, we can start to build a picture. Out of 12 practices, we had the cheapest drug spend, yet the second best QOF score for glycosylated hemoglobin control. The practice that achieved a slightly higher score did so for 30% more in costs. When you look at how costs were kept down, it was by prescribing fewer drugs and using the ones we know that work with an established evidence base for their use, such as metformin. This work was repeated 1 year on, and the pattern continues. There can be several factors for this finding, but I am convinced that the emphasis on lifestyle that care planning brings to the way we work has a large part to play in it. It comes back to the time we are able to offer patients so that they can make informed decisions and come up with ways of helping themselves rather than reaching for the prescription pad. So in summary, we won't be going back to the old pattern of care. The data for our practice graphically illustrates that it is possible to be a low-cost prescriber yet maintain excellent clinical results. Doing so is not a matter of chance. It is down to good planning, care planning.